if you don't take your treatment and if your viral load is not controlled or suppressed, you face the higher risk of having worse complications.
Hello there and welcome to the guest segment on Africa Business Radio. I am Chukunonso Modi. Today we are talking health, particularly HIV and AIDS. It was World AIDS Day a few days ago, and HIV/AIDS is one epidemic the world has been battling with. Globally, the region is considered to be suffering a hyper-endemic, that's HIV epidemic, if more than 15% of the adult population is HIV positive. Joining us to talk about grassroots solutions that can aid the fight against HIV/AIDS is a woman who completed a BC degree in nursing sciences in 2015 at the University of Pretoria. She was appointed as professional nurse in March 2019, working at Hlokomela PHC Clinic, seeing chronic and acute patients and doing mobile clinics to lodges. She is currently clinic manager at Hlokomela. Welcome, Laverne Stebbing. It's a pleasure to have you here.
Thank you so much, Nachta.
All right. So let's go right to it. We can't start this conversation without talking about the current state of the healthcare sector in South Africa. So tell us, how is the healthcare sector faring presently? What challenges, threats is the sector facing as regards delivery of healthcare?
So I think the South African healthcare system is facing or bombarded with COVID-19 at the moment, leaving a lot of other chronic illnesses and conditions behind, such as HIV and AIDS and also TB. So currently at our clinic, we are unfortunately seeing a rise in COVID-19 cases, which increases the workload at the clinic and inherently decreases the time that we have to spend with our chronic patients.
I see. Now, you're right in saying that diseases like HIV/AIDS gradually fade into the background with this advent of the pandemic, and especially as we are seeing a recurrent, we had the first wave, second, third, and then now we're on the fourth. So why is that? Is it safe to relegate something like HIV/AIDS to the background?
Definitely not, because they are a population that's very at risk or high risk, especially with corona being immunocompromised. So we should actually focus on our chronic patients, to get them their chronic medication in order for them to be healthy and in order for them to fight corona with decreased viral load if they take the medication. Yes.
Okay, so you're saying a person who has HIV and also, for instance, catches corona, it's even double risk for that person. Is that what you're saying?
Definitely. So if you don't take your treatment and if your viral load is not controlled or suppressed, you face the higher risk of having worse complications.
Okay, all right.
That counts for any other infections you might have. So if you have HIV and your viral load is not controlled, you face a risk for even flu or an STI that you will get much more sick of.
Okay. So now, what are those important things you feel people should know about HIV/AIDS? Things that should be out there, but for some reason people don't know about it, they don't pay attention to.
Especially on World AIDS Day, we want to get the message out there that prevention is better than cure. So preventing HIV even before that, you need to take treatment for it. So having safe sex practices, condom distribution is important, and making sure you and your partner both know where you're standing with each other, to know your status, and just for the stigmatization towards HIV and AIDS to decrease that. That is something that we see a lot in South Africa, especially in rural communities, smaller communities. We in Hoedspruit, Limpopo, we are a farming community. So we are very intertwined with the employers of the farm workers. So there's still a stigma that we are working daily towards to break and to decrease in I think I speak for most of South Africa, to decrease the stigma that's around HIV and AIDS.
Okay, all right. Now, for this epidemic, how can we fight it? What are the grass solutions that can make a difference in the fight against HIV/AIDS?
So, like I said, to be informed, and prevention is better than cure. So, if you see maybe there's a field outreach or an informatory talk, to go and attend it, or if you don't necessarily know what HIV is, to go to your local clinic and to know your status, to do an HIV test, and they will give you more information regarding that. I think it's a big step to try and say how we're going to fight. We've been in this fight I'm speaking for Hlokomela for the past 16 years, and 16. From 2005, yes, so from 2005, where the prevalence was 23.9% in the community, daily working towards decreasing the prevalence, we are at 6% at the moment. So from 23.9% to 6%. So it's been, over the past 16 years, it's been a daily fight where we just give information and preventative practices in order to make sure people do the prevention that they need to do.
Yeah, so I agree with you that awareness is really important, because people need to know what it is that they're dealing with. Now,
yes, and knowledge is power. So if you have the knowledge, you will be able to even give that knowledge to your partner and family members and friends, and then together I'm sure we'll definitely see even a more decrease in prevalence.
Okay, yes, perfect, true. Now speak to us about the Foundation Tshemba and its partnership, of course, with Hlokomela. Tell us about this partnership. What is the importance of this partnership?
So Tshemba Foundation is a volunteering network of doctors and healthcare workers that come from anywhere over the world. So even from South Africa or the Netherlands or Singapore. We've got doctors visiting us from the UK that actually unfortunately had to go back to lockdown. So it's doctors and healthcare workers from all over the world that come and share their expertise with us. So it's from generalists like GPs to specialists like your gynecologist or ophthalmologist or dermatologists that come and give their time at various primary healthcare institutions, and Hlokomela is one that they also come and volunteer at. So especially in the rural areas like Hoedspruit, not being rural, but it's a very remote area where hospital services are overloaded and the workload is just overloaded. So for Tshemba to send a specialist to one of the primary healthcare clinics just helps to access that specialist care, especially for farm workers that doesn't always have time or the resources to go to hospital. So they make it possible for us in order to have access to that specialist care.
Okay, perfect. That's fantastic. Let's speak about funding now. How has Hlokomela been able to secure the necessary funding for this project, for this awareness, this fight?
So Christine de Pre is our director. She's been the one that started Hlokomela in 2005. So she has secured funding over this past 16 years, writing proposals to various funders. So we get all our chronic medication from one of the district hospitals in Maruleng, which is a district for Limpopo, and then we also get some acute medicine. So luckily we get the medicine from the facility, but for funding, we're very reliant on donations and funders in order to keep us going.
All right. Now, Tshemba Foundation is doing real good with the help they're giving Hlokomela. how can you become a volunteer with the foundation? I mean, you've said that it's not just in South Africa, it's around the world. So if you're interested in helping to fight the cause, how do you join?
So you can visit Temba Foundation with the website, and then you apply by filling in an application form. So you need to be a registered healthcare worker, or you had to fulfill your studies within the healthcare to be able to be recognized to be a volunteer. So you can go onto Temba Foundation website. They also have a Facebook page, or alternatively you can also go onto Hlokomela website or their Facebook page. And if you struggle with anything, or if you want more information, you're more than welcome to contact the clinic.
Okay, thank you very much for that. Now, lastly, let's talk about the role the government has played in this fight. How have they helped NGOs like yours to push through?
So we have a memorandum of understanding with the Department of Health, especially Limpopo Department of Health.
Okay.
And they assist us in doing these preventative services, assisting us with, like I said, the antiretroviral therapy, as well as the HDS test kits. So we have a very good understanding with them, as well as the laboratory services that we need to follow up on to monitor our patients. So we've got a memorandum of understanding with the government, and we also try to see where is the need and to be able to tackle the need.
Okay, fantastic. Thank you so much for this conversation, Laverne.
Thank you, Nonso.
Okay, that was Laverne Stebbing, Clinic Manager at Hlokomela. More coming your way shortly. Stay tuned.